Well, let's talk to Jamie Jenkins. He's an independent statistician and a commentator and joins us now. Good morning to you, Jamie.
Morning, Julia.
You have to say, anyone who's not following Jamie Jenkins on Twitter right now, please do, because you will get to the heart of all these issues very quickly. You're not just Mr. Random, I thought I'd have a go looking at some numbers statistician. You were the former head of health statistics at the Office for National Statistics. You know of what you speak. This idea that we need an immediate return to COVID restrictions because the living with COVID is the straw that's breaking the NHS's back. Is there any truth in that at all?
Well, no, Julia. I think let's go through the facts and figures then. So I think one of the things that was cited in this article or this letter to the kind of government is the fact that there are more patients kind of in hospital or admitted to hospital with COVID now than there was this time last year and the year before. But the problem you've got when you start quoting those figures now is, if you remember, Omicron hit the country in December and is far more infectious. And these new subvariants that have been circulating in the last couple of months as well, they're even more infectious as well. A lot of people have COVID now, Julia, and when they go into hospital, they're tested for everything. And 2/3 of people who go into hospital now with COVID are primarily in for other things. So that wasn't the case in 2021 and 2020. So when you quote in figures about patients in hospital with COVID, just imagine a scenario tomorrow, a bit extreme, but everybody in the population had COVID tomorrow. Well, every single admission to the hospital would be with COVID, not because of COVID.
Yeah.
So,
and again, a lot of those people are catching COVID in hospital, as has been the case throughout. They've not gone in with it, but they're just surrounded by people with it. But also, small point, they're not actually in ICU, most of these people, desperately in need of mechanical ventilation, using up beds that would otherwise be needed for people in emergencies. They just sort of incidentally have COVID.
Yeah, and if we look at the critical care beds, Julia, so in the latest weekly data we get from the NHS in England, 7 days to the 12th of July, there are about 102 patients primarily in critical care because of COVID. Now, that's out of over 4,000 beds. It was 405 this time last year, so it's about a quarter. But remember now, not all the beds are full. There was over 1,000 beds unoccupied. So they're saying this kind of breaking the NHS. Yeah. And the thing now, I put a video on my Twitter and a couple of other social media platforms a couple of weeks ago saying that we're probably going to start hitting the peak around now, because if you track Portugal and South Africa, where they had this kind of wave before us, it went up for about 4 or 5 weeks, the cases, and they started coming down. Now, Scotland's data last week, Julia, admissions have peaked, they're starting to come down, and the data we had from the NHS yesterday in England shows that England has peaked and some parts of England are coming down. So you've got the east of England, the southeast of England, admissions are coming down as well. So we've already peaked and started coming down from this latest wave without any new restrictions. So writing to the government to bring back all of these draconian measures, what would happen, Julia, if the government said today, oh yeah, we will, or we get all these kind of lockdown fanatics saying, look, the numbers came down because we brought this in originally.
And that's what we've had throughout. But this is the third Omicron wave. We had a wave over the winter, and people say, oh, Boris Johnson was very brave, against the advice and didn't lock down. No, Partygate revelations had just come out, and he basically had a whole load of COVID recovery group MPs who basically said, we will oust you if you do this again, because the devastating effect on the economy and people's mental health and schools and goodness knows what else. We had another wave this spring, got another wave now, and in each of these cases, and last July, was it Delta last July? I know it was still around in October. We have cases that go up and they go down. And each time we have had a lockdown in the past, any of those measures, it has been at the time they actually limit what people can do at the point at which it's already peaked. And we know that it has already peaked in infections because it's already peaked in terms of the number of people going into hospital with it. So this is incredibly, let's face it, it's dishonest for these people to claim that this is the straw that is breaking the NHS's back. The straw that's breaking the NHS's back is not a straw, it's a big bundle of God knows how much, debris of the fact that the NHS turned into a national COVID service for about a year when we started this pandemic, stopped treating people for all the other things that killed them because they turned into a national COVID service, and we are reaping the effects of that still today.
Yeah, Julie, we had a survey out last week, big, massive survey, hundreds of thousands of people took part on the National GP survey. And people there saying that they hadn't gone to see their GP because they didn't want to burden the NHS. Now, all this protect the NHS, save lives. Now, we just literally in the last 20 minutes, Julie, had the latest ONS death figures out. So we can look at those as well. We are seeing deaths above average. I think you've been covering this story with some other kind of contributors the last few weeks as well. They are above average. They're again above average the latest week, 626 deaths above average when you take out all those deaths linked to COVID. Now, that's more than the deaths linked to COVID itself. You know, we're approaching 4,000 just in the last 4 weeks alone. And the thing that may have broken the NHS's back as well, Julia, were things like, we don't get the figures every week at the moment now. We used to get them through the winter. Is the number of patients in hospital who are ready to go out. They're already kind of well enough to leave the hospital, but they can't because there's not enough care workers in the community. And they sacked a lot of care workers last year because they wouldn't take COVID vaccines. Now, you've got this, and then there's talk about, oh, we need more money now for the NHS because the NHS is broken. Yeah. I posted, I think, a couple of days ago, a job advert went out on Friday for a new NHS Diversity Director of Inclusion. Now, this isn't for NHS England, there's one post. Yeah. This is for one area of the country.
And it was over 100 grand a year.
£108,000 a year, and you multiply that up by all the different trusts. I'm not sure everyone's having them. You start getting into the millions of pounds, and this is literally what you could be spending on 3 paramedics. The NHS really does need to look at, before they start complaining to the government to lock this all down, but again, look about where they're spending the money.
Going back to those excess deaths, it's absolutely extraordinary. The hysteria over a heat wave. Again, we know that cold kills people more than heat does by 75 times in this country. Those stats are well established in reports. I mean, not so much that difference in Europe, but everywhere around the world. It's cold that kills, not heat, far more. But there'll be all this hysteria about maybe there'll be a few dozen deaths, maybe a few hundred. And all of those deaths, very sad and very upsetting for those people and those families. I accept that. I'm not making light of any of it. But no one seems to care about the hundreds and hundreds, as you say, thousands of excess deaths we are seeing right now. Now, a lot of people say it could be due to the vaccine, it could be due to people not getting healthcare for the period, but no one's even investigating it. They don't seem to care.
No, we do get once a month, the ONS do publish a bit more detail on what the causes of some of these deaths are. I think we do need a thorough, proper look at the figures, Julia. And heart disease was one of the causes that was a bit of excess last month. We'll get next week some more figures on what's going on. But you're right, you know, all these lives matter. We've got to look at these as well as the deaths just from COVID.
Jamie Jenkins, you've been an absolute star throughout this. Thank you so much, as always, for joining us.